Free audio post-production by alphonic.com.
So one of the biggest things we do before surgery is make sure people aren't taking things that block the clotting of their blood, because you need to clot in order to heal from a surgery, right? So don't get in the way of clotting, but also don't get in the way of inflammation for that first week, maybe even 10 days after the surgery, because inflammation is your friend at that moment in time.
I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. Hey, Tina.
Hi, Leah.
Today we're going to cover something that we haven't talked about, side effects or supplements or all kinds of things that we used to talk about. So today we're going to talk about surgical support.
Yeah, I think it's interesting since surgery is such, it's one of the three primaries that we've had around for, forever in cancer care, but we haven't even touched on.
No, we haven't talked about radiation either, radiation support specifically. I mean, it's probably mixed in, as is, surgery and radiation support probably are within other episodes. But yeah, I just thought this is just something that I did, and that one of the cancer centers where I worked also had a protocol, which I know I've mentioned before, but we actually had a protocol mostly for abdominal surgeries.
Yeah, I think that's where there's the most evidence and most clinical studies with humans showing macronutrients and micronutrients and how they affect recovery and infection risk and all that stuff.
Right. But I still would... I would work with the dietitians, and we would make sure that patients were nutritionally sound and, just kind of had a plan going into and then coming out of surgery.
Yeah. Yeah. Ideally, pre-surgery, seeing people at least a few weeks before they go in is ideal. And depending on their state and their health, more time is better. Getting people ready and prepped and replete instead of depleted in nutrients.
Yeah. And since I would see patients at the cancer center in Arizona, we would see them from when they first came in. And so if we knew that surgery was probably on the table, immediately we would make sure that person wasn't smoking. And I mean, that's one of the biggest things that you can do is to quit smoking prior to any surgery, because smoking does impede healing. And we would often see complications with patients who hadn't quit smoking.
Yeah, that makes sense, because when you inhale the smoke, you're basically increasing the oxidation throughout the body. And yeah, I could see how smoking would impair healing just in a general sense.
Yeah, so I would have patients who were having surgeries for breast cancer, and I would notice that the patients who smoked had far more complications than those who didn't smoke. So, not to say that people who didn't smoke didn't have complications, because it can happen to anyone. Yeah. But yeah, the smoking definitely, we would have to send them to like wound care and stuff, the wound care nurse. So,
yes.
So I hope that nobody who's listening to us still smokes, but definitely stop.
Yeah, this is one of those times where your population and my population differs, right? So in a private clinic in a small town in Oregon, I had most people, I would say very, very few people were still smoking. Most people who were coming to see a naturopathic physician had already stopped smoking, even if they just did it recently, but they knew that was going to be something I was going to ask them. And they were like, I'm going to do this before I even walked through that door. But very few people had actually a recent habit of smoking, even, I would say less than 10%. So it wasn't the average patient who walked into my office, I don't think. And they were highly motivated.
Yeah, and I would just
already taking care of themselves.
I would just see the general public. So,
yes.
So I had a more...
I
don't know, diverse.
I think it just represented the general public more than my patients did, because mine were mostly women too. And obviously it's 50-50 in our population, but women are more likely to seek out a naturopathic doctor. That's always been the case.
Yeah. And depending on which oncologist I worked with, when I worked with one of them, I saw a lot of patients with prostate cancer. So I would see like a variety of patients. I mean, I saw breast, GI, prostate, all kinds of patients. So
where my prostate cancer patients, I would say 7 out of 10 of them were brought in by their wives or another female in their life. Like 3 out of 10 probably self-selected and they were proactive and came to see a naturopath. But I would say 7 out of 10 were dragged in. Not against their will so much as not exactly, they didn't have the buy-in. They didn't come in saying, I'm looking to actively change my habits. They were like, my wife is making me come here. I'll do what she says, basically. Tell her what to cook because she's going to feed me. That basically, honestly, that was probably half of my prostate cancer patients. I know. It's a sexist thing, but it's just the way it is. I'm not condoning it. I'm just telling you. Anywho,
so
back to surgery.
Bringing it back around. So making sure that somebody is like nutritionally sound, like nutritionally fit. There are some patients with cancer who, because of the cancer process, are malnourished, or because of the treatments that they've received beforehand are malnourished.
Yeah.
And so I think that's the number one priority, is just making sure that you're able to get in good nutrition no matter how you get it in.
I agree. Yeah. There is also now, when people have cancer, let's say they have a colorectal cancer and they've got some metastasis to the liver or somewhere else, there is also some surgeries happening just to control metastatic disease. So sometimes they've already had a colorectal cancer surgery or even an upper GI surgery, and maybe absorption of certain nutrients is impaired because of what was removed, or their ability to eat is impaired or something. And just being replete. When I say replete, that just means replenished. Think replenished. Replete in nutrients going into any surgery is always going to help prevent infection on the other side of it.
And facilitate wound healing as well.
And facilitate wound healing, where you need nutrients to heal that wound site.
Yeah. And so our dietitians would talk specifically about, different foods to eat. And then they had a product. The only one, there are a bunch of products out there that are specific for surgery.
Mm-hmm.
The one that I think that was mostly used was one called Impact. It's kind of like an Ensure, but it just has like arginine and omega-3s and protein, and then some other nutrients in there. I can't remember what it had offhand.
Yeah.
Probably some glutamine in there.
Yep. I think that's what the studies indicate, that perioperatively, meaning somewhere around the time of surgery, if people are given arginine, glutamine, and omega-3 fatty acids, they have less infections at the surgical site and better recovery, and just reduced severe reactions that require further hospitalizations.
Yeah.
So, and that's for major. And I think a lot of studies are done on the abdominal surgeries, because that's kind of, it makes sense. It's always a major surgery because you're working on the gastrointestinal tract. Other than just removing the gallbladder, or the appendix. But if you're working on the tube itself, anywhere from the mouth to the anus, if you're removing part of the tube, then it's going to impair.
Yeah, and like you were saying, depending on what part of the gastrointestinal tract is removed, it can create additional deficiencies. I used to actually have a chart, like an image on my bulletin board in my office, that was just a really simplistic picture of the GI tract, and it had at what point different nutrients were absorbed. And so then I could just kind of have my little cheat sheet.
Yeah. Yeah. I think that's a really good tool to have. I think that's something people should look at if they have had a surgical removal of any part of their GI tract, is to look at one of those. I would encourage people not to use an AI made one, because they are wrong. I've seen AI images of that on social media, LinkedIn namely, and I was like, that's actually not accurate. So go back to an original, like actual publication that has been peer reviewed, so people looked at it and double checked it. But yeah, those images are really helpful just to see, like, if you had surgery that removed your ileum, they can look at the chart and just say, okay, that is what is being absorbed there normally. So you might just have a higher need for that nutrient, whatever the nutrient is.
So specific nutrients that I think of, I always think of like the fat soluble vitamins. Especially like, I think there's a lot of evidence around vitamin D and surgeries, and mostly because a lot of patients in general are deficient in vitamin D. So just bringing that level up to a healthy level, it doesn't need to be like 100 or something. I think people are done making that recommendation. I remember for a while that was a really big kind of holistic recommendation. It was like, get your vitamin D over 100. Don't do that.
No, and here in the States, it's nanograms. It's in Canada, it's micromolar amounts, so the numbers change. But for us in the U.S., we're looking at a range, ideally a range between 40 to 60 would be like high normal, adequate. If you push it too high, now we know that there could be consequences to that, especially for certain cancers like prostate cancer. So we don't want to do supra-physiological doses. The physiology is such that 60 should be probably about right, although there's an exception. Studies show that when you had it higher than 60 for aromatase inhibitor-induced arthralgias, which is joint pain, I should say, that it improved it. So, there might be a little wiggle room there if you're doing it for symptom management, but you don't want to go too high because then you can screw up your calcium.
Right.
So, yeah.
Yeah.
We'll just leave it at that because we do have an entire episode on calcium and vitamin D
as well, right?
Go back and listen to those if you want to know all the facts around that, but we'll leave it at that for now. And can I say one more thing? I think you're right. This A, D, E, and K, all the fat-soluble nutrients, or vitamins, I should say. Those aren't all the nutrients. There are other nutrients that are fat-soluble. But those are the vitamins. If someone is taking a vitamin D in a capsule and they're taking it down and they're not absorbing it and their labs don't change, then that's a decent way to figure out that they're probably not absorbing fat-soluble vitamins. So if someone has a low D on their labs, on their blood work, takes vitamin D orally in a pill, doesn't go anywhere when you redo it, then you start to say, maybe they're not absorbing the A, the E, or the K either. We don't know. But I get suspicious. Assuming the vitamin D was a good quality. All right, that's it. I like to put those in there because this is like what happens to people. I had probably half of my patients, their D went nowhere when they took one. Nowhere. And so I would give them drops under their tongue instead of taking a pill because clearly they weren't absorbing it. And then I would be concerned about the A, E, and K. So I'm saying that because vitamin D is probably the one that is most well studied as far as nutrient deficiencies and outcomes. So outcomes in cancer are better when you have sufficient vitamin D.
I think that the number one thing that if I had a patient that wasn't having adequate levels, blood levels of vitamin D, and this is a way of me segue to our next nutrient, is I would make sure that they were doing it with some sort of healthy fat, or if they were taking an omega-3, to take it at the same time as an omega-3, because you need that fat to absorb fat-soluble vitamins. So you make sure you take it with food, because sometimes people just take a handful of pills with coffee in the morning, It's what they do. So I think omega-3s is probably one of the most controversial of nutrients that, in the surgery world, because for the longest time, patients were told to discontinue taking any sort of fish oil, and they still are. Patients are still being told, do not take fish oil.
Mm-hmm.
And looking at those studies, GI surgeries are the subject of a lot of these studies in terms of what nutrients help with surgical outcomes. There was no evidence at all to discontinue taking omega-3s.
Mm-hmm. Right.
And I mean, it was kind of emphasized like when part of it, when part of a balanced breakfast, when part of a balanced nutritional program. So like not to like overdo and take a ton of them, but if you incorporate, especially omega-3 foods, so doing sardines or salmon or walnuts, any of those cold water fishes are good.
Yeah. And that's the ideal way to get it in, I think.
Yeah, because then you're not
We do have to do supplements. Yes. The supplements are for people who can't or won't do the foods.
Right. Yeah. So making sure that you are taking in a lot of those types of foods. This is a best of episode because we did an episode on omega-3s. And so you can listen to that episode for more resources on, where to find those omega-3s in your food. Yeah, I think that's something that is kind of shifting.
I think so, yeah, because even in the conventional world, there are combinations of arginine, glutamine, and omega-3 fatty acids that are being used for surgical recovery. So I think it's getting more acceptance by the conventional world. We've been looking at it our whole careers, and so I'm going back 25 years. We were already looking at it, and the reason is omega-3 fatty acids provide the molecules that help resolve inflammation. So it's okay to be inflamed. You actually have to have some inflammation in a wound site in order to heal it, but it needs to be resolved as well. You don't want it perpetual. Ongoing inflammation is not good. You want it to resolve. And so omega-3 fatty acids provide the precursors to the molecules that resolve the inflammation. So yes, absolutely requisite. And, I came across another stat, and not to change the subject, but this is really, really common to be nutrient deficient if somebody is elderly. So 40 to 50% of older surgical patients are devoid of one nutrient or another. I don't know if I didn't go into details in this paper I was reading, but I'm going to guess it's some of the big dogs like zinc or vitamin C or omega-3 fatty acids, kind of the things that we need a lot of to recover on the other side.
In school, they used to talk about the tea and toast diet, right? Like you get older and your appetite goes down and you're not eating as a well-rounded meal with lots of antioxidants, because you need those too. You need the food like berries and all those colorful fruits and vegetables.
Yeah. And, I looked at the literature really like fine-tooth combed it quite a few years ago now. But at the time, I remember distinctly when it came to vitamins, specifically vitamins, whether we're talking about water-soluble or fat-soluble, when it came to vitamins, only vitamin A was shown to really have a role in giving more than just a daily allowance. And every other nutrient was you had worse outcomes if you were deficient in vitamin C, zinc, folate, like fill in the blank. You need to go into surgery making sure you have enough of them, but huge doses, mega dosing doesn't do you any good. The only vitamin that came up as helpful, and it was actually on the other side of surgery, vitamin A on the other side of surgery. But we have to be careful with vitamin A, not to pump too much of that because eventually the liver pays a price.
Yeah, and a lot of patients would even just become nauseated because there used to be that formula. There used to be that like supplement formula that was really popular. I don't know how many years ago.
Which one?
Don't remember the name of it, but it was like specific for like surgical support. Pre and post-surgical support, and it had a lot of vitamin A, and you were only supposed to take it for a set period of time, but a lot of people would become nauseated, even if they took it with food. It just, yeah. So,
okay.
But yeah, definitely eating a lot of foods that have those nutrients like zinc and A, and it's so, it's so easy to say like, oh, make sure that you're eating all these foods, but if you're coming out of chemo or radiation and your appetite isn't that great, I think that's where like things like smoothies come in.
And I think a multivitamin, not a mega dose one, but just
a multivitamin as well. I mean, it could be just one that has, like you said, like just the really basic amounts, not one where you need to take 4 capsules daily or something. Just like one of those, like one a day that maybe isn't a tablet, because tablets don't necessarily dissolve, and some of those products just aren't that great quality. But I would even recommend gummies.
You would?
I mean, if somebody just couldn't do capsules, I mean, there's some gummies. I mean, they're higher in sugar, but, it's like if someone's going to take it, then take it.
Yeah. Maybe for something essential but hard to get in food like zinc.
Well, like a gummy multivitamin.
Yeah.
And then they're not like, so like, they're like, oh, I have to take 4 of these a day? Tasty. Tart.
Yeah. like a little
candy. Like a little candy. It's a little reward. But yeah, so like definitely doing a super basic multivitamin, I think, is good before and then after surgery.
Yeah. And after surgery, it's an interesting thing. Like I just mentioned, inflammation is required. Well, the very first thing is where they did the surgery, you need to produce clots. So clotting is required. So one of the biggest things we do before surgery is make sure people aren't taking things that block the clotting of their blood, because you need to clot in order to heal from a surgery, right? So don't get in the way of clotting. But also don't get in the way of inflammation for that first week, maybe even 10 days after the surgery, because inflammation is your friend at that moment in time. So I was always someone who was like, I know you want to take, anti-inflammatories and you want to heal, and you read everything online about taking curcumin or other things that are anti-inflammatory after surgery, but wait minimum 1 week. Maybe if it's a big surgery, 2 weeks. Let the inflammation do its thing, which is to call in immune cells and have a nice, strong immune reaction to make sure you don't get an infection, because you don't want to dampen inflammation when it is appropriate. And that is when that first week or 2 after surgery, depending on the size of the surgery. So that was one of the things I always talk to people about, because I don't think that it's clear out there in if Dr. Google and such. I don't think anyone really talks about the phases of, healing, like blood clot first, inflammation next, then you start to heal the wound.
They do go over medications, make sure that you stop certain medications, and that all of that has gone over. And patients are often told to discontinue all supplements as well. And that would also include a multivitamin. But if you can, like you were saying, start this weeks before, and then then when you stop, then you just continue, if you're able to continue those foods. We're not going to necessarily talk about like post-surgery, like if it's a, gastrointestinal surgery and you're on specific diets. We're not going to go into that, like where you're not supposed to eat certain things following surgery. Like that's not the talk we're doing. We're just doing kind of more of the support.
You're referring to specialty diets like the low residue
all
diet?
Of those things. Yeah, where people are told, your NPO for however long following a certain surgery. Like, don't be like, well, I saw this podcast where they said you take these vitamins. Like, don't do that. That's not. We're generalists here.
Yeah, yes, we're doing a general thing. And if you're doing a specialty diet of any kind, you should be under the direction of a dietitian, nutritionist, naturopath, somebody who knows it well and practices it a lot. So therapeutic diets, I would put low residue diet right in there.
I would strictly a dietitian.
Yeah. But I think that of all therapeutic diets, I don't care if someone's doing a ketogenic diet, a vegan diet, like somebody should be looking at nutrient intake and making sure that it's still healthy, because a lot of therapeutic diets should not be done without some supervision to make sure that you don't push your body into a more trouble.
Yeah, or like a more deficient state.
Yeah, deficiencies, uric acid, stones, all sorts of things that can happen with various therapeutic diets are never, when I say that, I mean they're diets that generally speaking, most people do for an interim, like a time frame, and then stop doing it. Some people do ketogenic diets in perpetuity, which is fine as long as they get labs done and meet all their nutrient requisites. It can be done.
I have another nutrient that I want to mention. And I guess it's a nutrient. Well, it's a food. I think eating probiotic foods, a variety of probiotic foods, not taking a probiotic, but eating yogurt and fermented foods around surgery, kefir, sauerkraut,
kimchi.
Yeah, all of those. Eating those as part of your diet perioperatively. Look at that word. Yeah, I think that's really beneficial as well, because there have been some studies showing that probiotics, especially getting all those antibiotics and stuff while you're in the hospital and during surgery, all of that. So yeah, definitely doing probiotic foods, I think, is important.
Yeah, and as one goes into surgery, yes, going in as healthy as possible, and those antibiotics are going to be almost inevitable for some of the large surgeries. I mean, you have to do them. And they will throw off your gut. So yeah, doing anything you can to keep that in balance is a good idea. And we should all be eating something that's fermented every day anyways, if possible.
Yeah, so then just continue with your regular probiotic intake. No, it is something that I think people just don't necessarily think about. So if you're not typically eating those kinds of foods, try to incorporate them into your diet.
Yeah, and then stick to that habit afterwards.
And again, if you don't have an appetite and all you're doing is getting down smoothies, you can throw some yogurt or kefir in a smoothie.
Yeah, that's a good point. And you can also, I think a little bit of vitamin C and zinc is not a bad idea. And vitamin C goes into a smoothie easily. I mean, you're already doing berries, which have some, but if you want to open up a capsule and throw it in your smoothie.
Yeah.
Or buy a powder, vitamin C is an easy one to increase. And it's needed.
Yeah, because it helps with collagen formation and wound healing.
Yeah.
And then you mentioned zinc, and I think we did an episode on zinc, maybe?
I think we did.
I can't remember. Maybe we did. But if you are taking any sort of supplement that has zinc in it, I mean, zinc comes in nuts and seeds and a variety of foods. But if you are taking a supplement, make sure you take it with food, because it also can cause a lot of nausea.
Yes. Yeah, unfortunately in nature, the largest concentration happens to be clams and oysters and things, that little crustaceans on the bottom there, which is also where a lot of our heavy metals and kind of toxic compounds can live. So if you do get it from shellfish, then be careful that it's cleanly sourced.
And yeah, I'm just thinking about, like, if you're coming out of chemo, maybe you might not have a taste for shellfish. I don't know. But that's why I always like nuts and seeds, or or like nut butters and stuff like that.
Yeah.
Are nice sources of that. Can you think of any other nutrients?
Nutrient-wise, vitamins and minerals less so. I'm thinking about quercetin and rutin, and those are bioflavonoids that are needed and have been shown to be helpful for healing of tissue. So I would routinely do a supplement that had quercetin in it on the other side of surgery. I didn't care so much going into the surgery, but there's evidence coming on the other side of it that it promotes proper healing. And I remember coming across one study that was specific to people who tend to form keloids. So if you're a keloid former, which is basically a scar, a scarification on the skin, and it ends up being kind of convex, right? Quercetin was shown to lessen keloid formation in people recovering from surgery. So I thought that was kind of like, I would just put it in there as a routine piece for recovery.
Oh, and that kind of there's one more major nutrient which we haven't discussed, but talking about the quercetin, there was some research looking into taking vitamin C, reducing the risk of complex regional pain syndromes. And so, like you mentioned, like maybe taking a little additional vitamin C is a pretty good thing, because that can happen sometimes after surgeries. And so making sure that you are getting in a lot of those vitamin C rich foods, and then maybe taking an extra supplement would be an important thing to do. Can you guess the one nutrient we did not discuss that is probably the most important?
Most important?
I think so.
Besides protein.
Did we talk about protein?
Oh, I guess we didn't.
Oh, protein.
But yeah, we did it kind of in a backdoor way.
So protein would probably be the most important. And so that's where getting in one of those, if you're not able to take in, or, the volume of food for whatever reason, finding like a really good supplemental protein source. Like I like Orgain, I like Kate's Farm. I think Kate's Farm is still out there.
But and the nice thing about those is insurance will cover them sometimes. And I know Kate's Farm will work with people to help get insurance to cover it as a medical food.
Nice.
Both of those do. Yeah. So you can call their 800 number. They're both very, open and try and advocate for patients, because they want to sell their product, but also because they believe in what they're doing. So, yeah.
And then I know Orgain also has like a whey-based one as well.
Yeah. And collagen is one we should talk about too, because it has almost all of the amino acids, but it is missing one essential amino acid, which is why we don't consider it a protein supplementation. Collagen, hydrolyzed collagen, which means they've broken down a long collagen molecule into pieces, and they're usually 2, 3, maybe a few more peptide amino acids. So you've got peptides that come out of the collagen. That's what hydrolyzed collagen is small chains of amino acids. It's missing tryptophan, so we can't call it a protein supplement because you need tryptophan. But that said, collagen has its own possible role here in increasing the manufacturing of more collagen, basically working on the fibroblasts to help collagen get laid down in your own body. There's 27 different types of collagen in the body. So what collagen does is some of those 2 and 3 amino acid chains, those little di and tripeptides, go in and tell your system to make more. So through your fibroblasts, it actually signals the fibroblasts to say, go ahead and make more collagen in this tissue. And whether that's, like I said, there's 27 different types of collagen. So how it doesn't, it's not as exact as a drug. But I can tell you that is what happens with collagen. It does help. Collagen begets collagen.
And there is a product that probably is also covered by, I don't know if insurance, but at least your FSA will cover it. And it's Juven.
Mm-hmm.
And I actually took that around all of my breast surgeries. And it was something that dietitians would definitely recommend for, patients getting even larger surgeries. And that has collagen. It has a bunch of nutrients in it, and they're flavored, which I did not try, but then there's the unflavored, and I would just put that in a smoothie, and you got to drink it fast because collagen congeals. And so it's something that gets this gelatinous thing. So if you don't really slug it back, it's a little hard to take. But yeah, Juven, I thought was a great product.
And for the other nutrients, I just want to put an honorable mention, because I kind of said it in an indirect way, like go in, replete in everything. But the other nutrients we're not going to give a lot of time to. Magnesium, you need some copper, you need some vitamin E. Those nutrients are absolutely necessary for healing a wound. So depletion or deficiency of any of these nutrients is going to be the worst thing to happen, deficiency in protein or any of the vitamins and minerals. So without going into great detail on those, because again, we have whole episodes on some of those, but suffice to say, go in making sure there is no deficiency of any nutrients, and you should come out the other side in better shape than those who don't pay attention to that.
Some of those nutrients that you just mentioned, the minor ones, again, I don't know why I'm stuck on nuts and seeds. I think because I have a little bowl out on the counter that has a bunch of mixed nuts in it, so I'm obsessed right now. But yeah, a lot of those are found in nuts and seeds. So there you go. Blend those into your magical surgical smoothie.
Yeah, and fresh is best with nuts and seeds. So wherever you live, look nearby. So walnuts, pecans, what grows near you you can often get those from local purveyors. I don't know, just in season, and those oils are still intact, right?
Well, yeah, and I always refrigerate mine. So, when you open up a package, if you're not able to get them fresh from a hazelnut farmer in Oregon, I just put them in a jar or in a bag and stick them in your fridge to keep them fresher.
But those, and in like flax seeds too. Like if they smell off, then they are off.
The ground ones, the whole ones for those don't need to be in the fridge. But we have a whole episode.
Right.
Wow, this is a best.
This is what happens when you have This is when you have there are over 100 episodes. I guess we've talked about a lot of things.
But we're putting them all together. This is the compilation. So one thing I think that isn't talked about a lot, and it was something that I did experience personally as well as with my patients, is exercise, physical therapy, or occupational therapy around surgery. And I think one of the best things that I was offered was, I had neuropathy following chemo. And so I was working with PT and OT anyways. And because, you're a fall risk with neuropathy, and then after surgery, you're a fall risk. So they also worked with, and they actually came to my room while I was still inpatient, because back then you would be inpatient for a day following surgery, especially because I had a lot of nausea. Yeah. So they were like, we're locking her up. But they had these devices to show me, like, you can't reach your arm up, you can't put your socks on. And so they showed me ways of working around that. And then they also helped, because after surgery, once you're allowed to put your arms up, like, they gave you the exercises to crawling up the wall, like in the shower, for mobility in your shoulder, because with breast surgeries and upper body surgeries, that is often an issue. And so seeing if you can get a referral. And, a lot of surgeries, not just breast surgeries, but there are other surgeries where you're at risk for lymphedema. So like if you had radiation to your head and neck, or you're getting a head and neck surgery, you can get lymphedema as well. And then in the lower part of your body, if you're having a gynecologic surgery, you may be at risk also if they're removing lymph nodes. Yep. So being proactive, if you are told there's a possible risk, and trying to meet with physical and occupational therapy before and after.
I think that's a really good idea. I think before, especially, because after you're kind of recovering, right? I mean, it's a little hard. I think doing a little prep before and having them tell you and knowing what to watch out for and already having a relationship with the therapist, I think it's a really good idea. And they might give you some, like you said, some things to do before, just to prep for the surgery.
And I think that was one of the things that I really liked about where I was working, was I was able to refer people to like speech therapy, so that they would be familiar with speech therapy if it was going to affect their swallowing afterwards. They would establish a relationship beforehand and kind of be prepared for what they were about to,
Yeah. And I think the most important thing when you have to advocate for yourself, which is, you and I had the privilege of working for hospitals that were very proactive and very patient-centered, and people who are in community clinics around the country, and I'm sure around the world, don't get that kind of proactive, personalized attention. So advocating is something that I think is best done by a loved one. If you can delegate, whether that's your spouse, your mother, your sister, your brother, your daughter, it doesn't matter, but somebody who is good at advocating already, because these people exist, and then just having them advocate for you and with you kind of helps it helps a lot because I think it's exhausting to have to self-advocate all the time.
Oh, absolutely. Because I feel like as a cancer patient, you are doing that anyways.
Yeah. Yeah. I mean, because as we're talking about this, I'm thinking, there's only so much bandwidth someone has to do these things. I mean, you have to actually be the participant in going to see the therapist and stuff. So it'd be nice if there is a small hurdle to getting that order from your doctor or however you have to obtain it, wherever you are, if someone else is doing that for you and with you. Because it's just on a to-do list, it gets too overwhelming, I think.
Yeah. And then even, talking to someone, because there are more and more cancer centers that are starting these, cancer specific exercise programs. And so if you are getting a surgery where you're restricted in any way, your muscles will start to decondition. And so making sure that if you are able and you're cleared to work on strength training, doing some aerobic exercise, whether it's walking, cycling, and with the strength training, it could even be like resistance bands. And then working on balance as well, because sometimes you take medications after surgery and it could, make you off balance or just for whatever reason. So doing a well-rounded exercise program.
Yeah, I agree. And they're still being researched. So there are exercise programs out there within the oncology sphere where people can partake for free or even get paid to be part of the research, depending where you are. So if your community clinic is doing the treatment, that's fine. You can just look to see if there's an academic center nearby. If you have a city center or a large college, they're most likely to be doing it. So yeah, look around. You can go to clinicaltrials.gov and put in some keywords like exercise, put your under your cancer, and start looking to see if there's somebody nearby doing it, because there's a lot of research going on in this field right now.
Yeah, it's really hot right now.
Yeah.
And then kind of on the opposite side of exercise would be certain energy conservation techniques. And the one that I always remembered that I was given was, like having a sort of a bar stool that you could pull up when you're doing things like doing the dishes or like sitting down when you're folding clothes, like using your energy sparingly, because after surgery, it is exhausting and it does take a while to recover. And so kind of focusing, like exercise is good, but so is energy conservation.
It's interesting that you say that, because I distinctly remember it's very frustrating when people don't get their energy back as quickly as they'd like to. But what you cannot see is how much energy it takes to heal from your treatment. I don't care if it's chemo, radiation, or surgery. And in this case, we're talking about surgery, but it's an extraordinary amount of energy, as in ATP, as in sugars and amino acids and the cellular, actual manufacturing of new cells to lay them down and recover your red blood cell counts, and your white blood cells are working hard, like they're getting pulled out of your system by your spleen. And, there's a lot going on that you cannot perceive, but you do indirectly in being tired. And so if you are tired, you do need to listen to your body. And if it's energy packets in a day, I do like that idea of energy packets. A lot of them are being used just to heal. So it leaves you with less energy packets to do your day-to-day activities. So I think that's a good idea. Be careful. Don't push it too hard, because then you're going to leave the healing packets wanting, right? So if you push yourself too hard, you're not going to heal well.
Yeah.
Yeah.
And I actually recently saw a post on some social media app about someone was saying that they were recovering from surgery, and how long is this going to take for me to start to feel kind of normal again? And I think that's what kind of inspired me for this episode, was like, oh yeah, we really haven't talked about that. I do want to add in some like hot tips for like when you're in the hospital.
Okay.
So I recommend that everyone bring an eye mask and earplugs, because the lights never get dark if you're going to be inpatient for a while. And earplugs, there's always some sort of noise. And you can also freak out your nurses because you have earplugs in and they try to wake you to take your blood pressure in the middle of the night, and then you don't stir and they kind of freak out. So let them know that you're going to be wearing earplugs.
Yeah, right?
Because, I did that to my nurses. So
now that is a good one, because sleep is so important in recovering. So yes, our body repairs tissue and does most of its repair work and replenishment while we sleep. So without sleep, you are more likely to have infections, because it's immune suppressive to be sleep deprived. and you're more likely to have complications in general. So yeah, sleep. Good
Yeah,
idea.
like I said, especially if you're going to be inpatient. Something else that I brought in with me inpatient was a essential peppermint oil inhaler that helps with nausea because I'd never had anesthesia, and I'm so glad I had that. I also asked my husband to make sure that there was ginger ale nearby just in case, and I needed it. I mean, I just remember like in this delirium, and like I said, they admitted me because I was so nauseated after surgery from the anesthesia, and I was just like, oh, I think I'm gonna get sick. Do you have ginger ale? Like just in this like complete delirium, like, and they did like so. Make sure that whoever is your caregiver for surgery, if you can take things by mouth afterwards, obviously that's the big thing, depending on where your surgery is, but. Yeah, see if they can have like ginger ale or ginger tea or something available for you to kind of sip on. I mean, they have medications too. There are definitely medications, but I was having complications from my medications. I was so constipated. So yeah, I just wanted like a little bit of ginger ale, and then I had my peppermint inhaler, and that actually helped. And the fewer medications you take, you know, or that you need to take, you know, if you need them, obviously take them.
Yes, of course. Yeah.
And then there was something else that our dietitians recommended for patients, and again, this is all if you could take things by mouth after surgery, but if you are constipated after surgery, depending on your surgeries, obviously ask before you do this, but chewing gum post-surgery can help with stimulating your gut and having a bowel movement. So that's something else that if you're taking a lot of pain meds, you could try chewing some gum.
That's a good idea.
And then acupuncture. We always forget acupuncture, but acupuncture before and after surgery, I think, is really helpful. After surgery can help with pain and relaxation, and it helps reduce anxiety even before surgery. They don't typically do that in hospitals, and they don't typically do that inpatient. But yeah, getting acupuncture, once again, I'm going to use that word perioperatively, can be really helpful.
Yeah. I like all of those. And ginger people, which we've mentioned here before in other episodes, ginger people make a bunch of different products from chews to little sodas, and ginger people use real ginger in their products. I think they make the gin-gins.
Yeah.
The little hard candies.
And my favorite, because we used to have those at the cancer center and I didn't really care for those. My favorite's tummy drops. Tummy drops, I think, are delicious.
Yeah, the gin-gins are intense.
Yeah. And they're
almost hot.
Yeah. And the tummy drops too. That's my favorite.
Yeah. Remember Reed's ginger ale?
Yeah, it's still around.
Is it still around? Oh, okay.
You're not going to find that.
I haven't seen it
in hospitals. I wonder if they used to have that at CTCA. I can't remember. And then something else that I was reading that could be very helpful. And this is all part of when you go to a multidisciplinary integrative cancer center, you will find a lot of these things. But even seeing somebody like a mind-body counselor, because depending on your surgery, there's a lot of stuff around that. And so dealing with that psychosocial aspect,
I agree,
before and after surgery is so important. And that's something we don't really talk a ton about on this podcast. I think we need to find more experts to kind of, to go there.
It'd be nice to talk to is an anesthesiologist. I'd be interested to know exactly what happens when we go on.
I know one.
So, do you know one? Maybe we should get that person on the show.
Like a friend of mine from when I was in the 5th grade. Yeah.
That's awesome.
Yeah, I can ask her. Totally. I know one.
So it's an interesting thing. I mean, I've had surgeries before and only once have I had to go under, but I found that was the most stress-inducing part of the entire thing. Not the surgery, not even the recovery. Didn't like the idea of being completely out of control and under somebody else's control.
Interesting.
Being under and being completely out is what freaked me out more than anything else.
Oh, wow. See, I was excited because I'd never been, people are like, you never had anesthesia for dental work or nothing. And so I was doing that countdown when you're laying there and they're like countdown and you're trying to fight. You're like, whatever, 10, 9. I was trying to remember everything I could possibly remember before I went out.
Yeah. That's funny. No, in the recovery room, I was sitting bolt upright watching my numbers. the nurse finally came over. She's like, we're watching, because my O2 sats kept going down. And so I was like, "Ah!" Like I needed to be in control of the situation, even though I wasn't at all. So yeah, it's a control thing for sure for
Oh,
me.
interesting.
Like,
Well, I think people just in general, I mean, it is scary. The thought of being put under is scary if you've never had anesthesia.
it is.
I mean, people hear stories and people love to tell you stories. So, but even that, like, having having a mastectomy,
Yeah.
having any sort of surgery.
Well, that's layered with so many
Well,
other.
that's what I'm saying, and even
Yeah.
like having, GI surgeries and having a hysterectomy, all of those types of surgeries. There's
Yeah.
a lot of stuff behind that. And so finding somebody that you can speak with, whether they're somebody who is at the cancer center where you are or finding someone outside, I think that's a really important aspect that also people don't always talk about around surgeries.
It's one of those things that I kind of wish was just part and parcel of seeing your oncologist.
I thought it was.
It's not even,
and it's not.
it isn't.
No,
No.
because that's the problem with me working in integrative cancer centers is that it is.
Yes, it is in integrative cancer centers, but it's not in general. And most people could use it. And sometimes not just the patient could use it, but their loved ones too. There's, cancer's kind of something that affects everybody in the house. So it feels like even if there's no perceived problem, no need for it, it should be something that people, see their oncologist same day or same week. You go see whoever they have for that, the counselor or social worker, whatever they are, however they're trained for mind-body stuff, and just to establish the relationship so that person can then say, I'm here if you need me. And if you want to talk, I will be your sounding board. And just establish it, because that first meeting, I think is the biggest hurdle. And then after that, people, the door's open.
Yeah. And so I think even at integrative cancer centers, it's available, but you might have to request it. I don't think it's an automatic referral. So really, again, advocating for yourself and making sure that you do see someone, because I really find that so shocking that that's not available, because that's my integrative bubble that I live in, is that's just, it's given. So
yeah, and true integrative cancer centers like you and I have worked at, when it was Cancer Treatment Centers of America, or you were in the Goshen system, I think, right? So they're hard to come by. True integrative cancer centers. I mean, City of Hope, who now is Cancer Treatment Centers, became part of the City of Hope system. I think they still practice what we are familiar with under the, right?
Yeah, but I don't know what the it used to be part of your intake was you would see all of these people, and I don't think it's part anymore.
Okay.
You might get a referral, but I don't know if it's part of it. Whereas at Goshen, mind body was definitely part of your kind of intake. So, but again, I don't know, because I'm long established at City of Hope, and so I'm beyond that. That's for the new patients.
Yeah.
So I'm not familiar with how they're doing their intakes, but yeah, I think you can kind of create your own little integrative center if they have them, like your own integrative bubble, by advocating for yourself and to get these referrals.
That's what patients did, because I had my outpatient clinic. I was their naturopath, and we had a dietitian or nutritionist, depending. And then I had a couple counselors in town that people could talk to. One was specifically for marriage problems that happen when people are going through treatment. So I thought that was a really interesting, referral, because it's very unique challenges to a marriage. There's a lot to unpack for that counselor. And then he was a NCI kind of researcher too, in addition to being a counselor. So it was an excellent person on the team. And that's exactly what people said. They created a team. They had a medical oncologist, they had me, they might have had another oncologist or surgeon, whatever, in the center, a nutritionist, and then whoever else they wanted, acupuncture, yoga, tai chi, qigong, whatever they like to do for body, mind body stuff. It was really nice, because they saw it as they were in control, and here's my healthcare team working with me.
Right.
And we all had the patient's, interest at heart, so it was easy to keep going forward and just never bucking heads, because we had a patient in common. So we all want the same thing. Right. So it was really unifying too.
Yeah.
Yeah.
And then, you do feel supported all around.
Yeah. That's the most important part, right? Is that the patient feels like they're getting the best of all the worlds. And I think it helped outcomes. I know it did. It wasn't even, I think it did. I know it did. So people definitely fared better when they put a team together.
So what we've talked about today, what we've covered are, your macro and micronutrients that are important for recovery from surgery, and starting these beforehand. And then when you're cleared, to continue them afterwards. And we talked about exercise, physical and occupational therapy perioperatively. I count how many times I say that word. I'm so impressed that I'm able to say it. And one thing I didn't really mention, but also try to see if when you see PT and all of these, services, like try to get a baseline so that when someone says, I'm not feeling like I'm improving,
right,
they can be like, no, actually you are, so always getting a baseline measurement is important. And looking to get the mind-body support as well, I think is important.
Yeah. There's plenty of studies to back you up on that.
Yeah. Like, there's actually like guided imagery after surgery to help with pain. So
yeah. In 2025, there were a couple of studies showing that depression, anxiety, and perception of pain all went down. Whether people did Tai Chi or Qigong or whatever they did for their, just to center themselves.
And those are great forms of movement that help with flexibility and balance as well. So,
yeah.
Is that a good summary? I can't remember what we talked about.
I'll call it the high points.
Those are the high points.
It wasn't a detailed summary, but we hit those are the high points.
All right.
Yeah. That's what rewind is good for. People could always rewind if they didn't catch something.
There you go. So on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
Free audio post-production by alphonic.com.